So welcome to this press conference of the Commission President, Mrs. von der Leyen, and Mr. Charles Michel, the President of the Council. Each of them will make a statement and then we'll take questions from you according to the new system we've developed. President, you have the floor. Good morning, everyone. The whole of the European Union and many other countries in Europe and elsewhere in the world are in some form or other of confinement. The restrictive measures taken by the Member States have been crucial in reducing the number of new infections. This has helped our healthcare systems to cope, but these measures come at an enormous price. Millions of people are stuck at home, far too often in small, in cramped accommodation, and they have to juggle telework and family life. Their children have to adjust to learning at home, and their activities are very limited, and the elderly are being isolated for their own protection. Now, on top of all these difficulties, there's a long list of economic difficulties for our citizens. Shops, restaurants and factories have all closed down. They've shut down most of their activities. Trade has slowed down enormously throughout the world, and governments are using all available means to strengthen their healthcare systems and to support the self-employed and enterprises. All this costs an awful lot of money. These actions are already costing nearly 3,000 billion euros throughout the European Union, and other measures are on their way, as the outcome of last week's Eurogroup showed. In this context, the public authorities have to assess very carefully the best time to start lifting the restrictive measures one by one. This is an extremely difficult task. The different countries of the Union have been affected in a different way in terms of the intensity and the exact timing of the pandemic.
Exist one-size-fits-all approach, but it has to be a tailor-made approach in every individual member state. Heads of state and government tasked us with a roadmap to ensure a coordinated exit from the confinement measures. Today, we deliver on this request. I want to make sure that this is not a signal that containment measures can be lifted as of now, but it intends to provide a frame for member states' decisions. In general, we recommend a gradual approach. Every action should be continuously monitored whether the virus flares up again or the spread of the virus stays stable below a certain threshold. And therefore, our recommendations focus on three main preconditions before starting to lift restrictive measures. The first one is there should be a sound epidemiological criterion that shows that there is a significant decrease in the spread of the virus over a sustained period of time. The second important precondition is, and it is combined to the threshold that is kept with the spread of the virus, that sufficient health system capacity is needed. There needs to be a reserve. This refers not only to the necessity to have intensive care treatment capacity for COVID-19 patients, but also for the other patients, like the chronically ill or those with acute other diseases. And the third precondition is, and it's self-explaining, if you have the threshold of the virus and the capacity in the healthcare system, you need sufficient surveillance and monitoring capacity in form of large-scale testing. These preconditions are accompanied in this roadmap by a series of recommendations to ensure a gradual, consolidated and a coordinated access across the European Union. For example, just to pick a few, awareness campaigns should continue to encourage the population to keep up the strong hygiene practices acquired. They are very simple, but they are very effective. Or general measures should progressively be replaced by targeted ones. And the restart of the economic activity should be phased in carefully. Let me turn to a second point, that is the global dimension of this crisis, also and mainly concerning strong countries but also vulnerable countries. As we all know, the virus knows no borders. It can only be defeated through international cooperation and coordination. What goes for the European Union also goes for the globe. The G20 has made this its focus, and I welcome that. On the health side, the key element is to cooperate and to improve our pandemic preparedness. And this includes how to accelerate the work on diagnostics, on treatments, and on the development of a vaccine. And if we have a vaccine, when we have a vaccine, then on the deployment of the vaccine all over the world. This is our collective best shot at beating the virus. To support this global initiative, funding is needed. And to this end, I decided to host an online pledging conference on the 4th of May. This will help address the immediate funding gaps to come up with innovative and equitable solutions. We have started the preparations in cooperation with the renowned organizations such as the Global Preparedness Management Board or the platform CEPI, Gavi, the Wellcome Trust and the Gates Foundation. Obviously, this will be done in close coordination with the WHO, and I hope that countries and organizations all over the world will respond to this call. And finally, to conclude, let me stress the strong link between a successful recovery from the health crisis and the effectiveness of our economic response. As you know, we have made available significant funds to support health systems, businesses and the livelihood in general. I welcome the Eurogroup's endorsement last week of the Commission's proposal, in particular the creation of SURE to keep people in jobs and the flexible use of cohesion funds. The Eurogroup concluded that, I cite, the next EU MFF will play a central role in the economic recovery. Ich stimme dem voll und ganz zu.
I agree with that entirely. I've often said in the past that Europe needs a new Marshall Plan. We'll need massive public and private investment to revive the economy, reconstruct it, and to create new jobs. And these decisions have to be taken quickly. And the key to this is a powerful a strong new EU budget. The budget has the advantage that it enjoys the confidence, the trust of all member states. It's transparent, the rules are clear. It's proven its worth as a driving force for innovation, and it's proven its worth as an investment instrument. But this new 7-year budget has to distinguish itself clearly from the previous ones. It will be different. It will be the European response. It will have to be the European response to the coronavirus crisis. It'll have to do an awful lot in the first few years. It has to get the common market up and running again, and it has to prevent a fragmentation of the single market, and it has to strengthen the economic resilience of Europe. It will have to promote investments in our future technologies, digital technologies, clean, environment-friendly technologies, which our prosperity in the future will be based on. Thanks.